According to the American Cancer Society, 1 in 9 men will be diagnosed with prostate cancer during his lifetime. September is Prostate Cancer Awareness Month, and the American Association of Clinical Urologists is urging men with prostate cancer to get a genetic test to determine the right treatment based on their genetic profile. Joining me now with information on the importance of genetic testing and how to avoid overtreatment is Dr. Mark Edney. Welcome, Dr. Mark Edney.
Thank you for having me.
So tell us, what are the treatment options available for prostate cancer?
Treatments range from surgery to remove the prostate, to radiation delivered from outside the body to the prostate, to things like freezing the prostate, which is called cryotherapy. An important option is active surveillance. Not all prostate cancer needs to be treated right away. Some of it can be safely observed, and that's the power of these genetic tests like the Prolaris test to help determine which men need to have their prostate cancer treated right away and which are safe to observe actively. And doing active surveillance reduces the rate of overtreatment of prostate cancer, which has gone on by necessity because we historically have not had a very good, reliable laboratory tool to tell us which are the aggressive and non-aggressive prostate cancers. We now have that with the genetic testing like Prolaris.
How big of a problem is the overtreatment of prostate cancer?
It's a very big problem. The estimates are that over 50% of men newly diagnosed with prostate cancer probably don't need active treatment right away, but they're being treated anyway. So it's an enormous problem. Also, the access and the use of genetic testing is far below what it should be. 90% of men aren't getting the genetic testing that's critical to making this decision. There are now national guidelines that support the use of genetic testing with the new diagnosis of prostate cancer. So it's a big problem, and we have the tools to make it less of a problem. We need to get the word out there, which is why it's great we're talking about it this morning.
So how do genetic tests actually help patients get the right treatment?
So I'll draw an analogy for you. If you line up 3 cars on a racetrack and you're trying to determine which car might be fastest or which prostate cancer might be most aggressive, you can look at the cars on the outside, which is how we look at prostate cancer now. We observe a pattern of cells. You could look at a car and look at the shape and maybe how it's painted, how it's designed to try to predict how fast it's going to go. With the Prolaris genetic test, we can look under the hood and look at the machinery of the prostate cancer cell and see what message are those genes telling the cell about how to behave, how quickly to grow. And so it's a much more precise evaluation of the aggressiveness of a cell, and that gives men and their families much more confidence in the decision to either observe the prostate cancer, and it also gives them greater confidence in the decision to proceed with treatment, because sometimes the test comes back and says, genetically, this looks like a very aggressive kind of prostate cancer. So it's very helpful both ways.
How are you using this testing in your own practice?
I use it all of the time. Every new diagnosis of prostate cancer in my practice, and I'm diagnosing about 1 prostate cancer a week, I use this test as a very important tool to go with the other pieces of information that we have to counsel men and their families about that critical decision. The initial decision always is this a prostate cancer I need treated? And I and my patients rely heavily on the Prolaris test to help make that really critical decision.
Where can people go for more information on this genetic testing?
For additional information, visit the American Association of Clinical Urologists website, aacuweb.org, or the Prolaris.com website, which is the website for the test. Lots of valuable information there.
All right. Doctor, thank you so much for being here. Very important information and something new for us all to understand and be able to talk to our doctors about. Appreciate that, and we'll be right back with more Midday Maryland right after this. Stay tuned.